Anthony Fauci. Yeah, that man, he's a megalomaniacal fraud whose analysis, policies, and conclusions harmed children. Everything he instructed us to do was self-serving or flat out wrong. And research from Johns Hopkins shows lockdowns barely saved lives by 0.2%. Tiny Tony was in Seattle receiving an award from the Hutch and dropped this narcissistic nugget about something he calls the Fauci effect.
It's called the Fauci effect. People go to medical school now. People are interested in science, not because of me, because most people don't know me. It's what I symbolize. People, the craving for consistency, for integrity, for truth.
Oh, yes, St. Anthony single-handedly saved modern medicine by being the inspiration for a new generation of Meredith Greys. My sweet keister. Med school applications are up because people didn't want to go to med school when nothing was being done in person. The same reason people quit their jobs and deferred to college. He shut down the known world out of an abundance of caution. And now that people are reverting to previous plans, he wants a medal. You know what the real Fauci effect is? He lied about everything, including gain-of-function research. The virus came God knows where from, but he did everything to cover his ass, so we'll never know. When actual science takes stock in the pandemic, from the shady origins to the tragic fallout of depressed children being robbed of normal childhoods, they will see, if there is an honest examination, that everything he told us was wrong. When asked by California health officials whether they should shut down the state, he said, "You really have no choice." But there is a choice. People can always be given the risks, and they should always be allowed to choose freedom. And they have. If, God forbid, this ever happen again, people will move to places like Florida with open schools and functioning economies versus places like California and New York that gave in to teachers' union terror and deprived kids of their right to learn and exist. Kids were propagandized to believe they were the problem. They were causing the virus, when it was really the highest paid government employee who used his influence and power in a ghastly failed experiment to engineer a solution that was worse than the virus itself. Dr. Fauci does not deserve medals or accolades. His work and hubris demand an investigation and consequences. So we are never terrorized by a self-important blowhard and a white coat ever again. And that's the memo. Now, given his record, Fauci is no fan of freedom. At the same talk, he complained about opposition to forced masking. Watch.
You tell people they need to mask in an indoor congregate setting. That is looked upon by a lot of people, not everybody, as an encroachment on your freedom. We've never had that before. It's almost inexplicable.
So what is the medical term for pompous, arrogant narcissism? The party panel is back. Jason Meister, Richard Fowler, Olivia Rondo. It's really hard for me to sit with a straight face and listen to him, Jason, because, you know, my kids, New York City public schools, the horrible mayor who was in office during the pandemic, Bill de Blasio, listened to Anthony Fauci, whose CDC was working in concert with teachers' unions to keep schools closed again for the entire year. So it's really hard for me to listen to what a great job he's done and how horrible people are who are skeptical of one person having that much power.
Yeah, Kennedy, I couldn't agree more with you. Look, I have elementary age children as well that were masked for 7-8 hours a day. Dr. Fauci has done more harm to undermine public trust in medical and scientific institutions than any other unelected government bureaucrat, okay, an official, health official. He lied about the masks. He lied about the vaccines. He lied about funding gain-of-function research. He lied about the threat. He lied about the Wuhan Institute of Virology. He lied about everything. So naturally, he says he symbolizes truth in science. It's a disgrace.
But it's interesting, Richard, because he puts himself at the center of everything. We're no longer talking about the virus. We're just talking about him, because he just wants to talk about himself. That is not helpful, because we're not talking about China. We're not talking about accountability and origins. And, you know, he's using his technocracy to try and distract us from that. But that is still the most important thing, so this doesn't happen again.
Well, we're also not talking about the fragility of our healthcare system. Right now, as we sit here and we have this conversation, we have a shortage of nurses. We have a shortage of respiratory therapists. We also have a shortage of doctors going into the field, and this should concern all Americans.
Not according to Fauci. No, not according. He says that medical school applications are on the rise because of him and him alone.
But Kennedy,
That's
I'm not talking about Fauci. I'm talking about my own reporting, where I've sat down with folks going into the field, and what you find is there's a lot of inherent barriers to folks going into the field. Number one, it costs $500,000 to be a doctor in the United States, and it costs $60,000 or $70,000 to become a registered nurse in the United States on average. And so what we've got to do as a country is say our healthcare workers matter because they're key to our existence, and what this pandemic should have taught us is just how fragile our system is, and the fact that we need more nurses, we need more respiratory therapists, and we should be investing in them.
Well, maybe we've got too many government regulations that is keeping all of this so incredibly expensive, Olivia, because, you know, these institutions, there is no accountability there, so they have no reason to keep costs low. So they can go ahead and stick it to doctors who will make millions more over their lifetime than people who get ordinary or no degrees.
Absolutely. Big pharmaceutical companies and institutions absolutely collude with the government so they can price gouge as much as they want. That's not a secret to anybody. Also, I have to pose the question, is part of the reason there may be a shortage of nurses and doctors be because there was a crazy vaccine mandate that fired like thousands, literally thousands of emergency personnel, medical workers, doctors, nurses? I mean, we really do have to reel back some of these government regulations. I think that ruling back some of the bureaucracy could be a great way on the, paying for college front and the actually getting and maintaining your job front when it comes to the shortage in medical doctors and nurses and all that.
Yes.
Kennedy.
Okay, hold on. I just want to respond to her, and then I'll let you respond, Richard. She brings up such a good point. You fired doctors and nurses. You told them if they weren't vaccinated, even though they had been exposed to the virus over and over again, that they no longer had jobs. You did the same thing with pilots. So they retired. We have a shortage of pilots and nurses. So flights don't take off on time, and it takes hours to see someone when you go to the emergency room. Go ahead and respond, Richard, please.
Listen, I hear that, and I think that's a very valid argument, but it's worth pointing out that the shortage started far before, or way before the creation of COVID-19. The shortage started in the early 2000s.
See, you said it. In the lab.
Creation.
Sure. It started in the early 2000s, and what the pandemic did is it just made it worse. And so if we're not going to talk about this now, the next time something else happens, it could be uniquely worse. And you're seeing these same people being put on the front lines as we as a country now to try to tackle monkeypox.
If it happens again, I will not participate in any orgies anytime soon, but I'm glad you brought that up. Okay, now,
mind you, it can spread beyond just participating in orgies.
I know. That's what, as a hypochondriac, that's what freaks me out. You get a pimple and you're like, monkeypox.